Hey everyone! Today I would like to share with you guys about walking frame. So, what is walking frame? Walking frame is one of the ambulation aids that is used to compensate for deficits in balance and strength, to decrease the pain and to decrease the weight bearing on involved joint. There are three common types of walking frame, which are standard walking frame, two-wheel walking frame, and four-wheel walking frame. Standard walking frame is the most stable but requires a slow and controlled gait pattern, as the individual must completely pick the walker up off ground before advancing. Two-wheel walking frame maintain a more normal gait pattern than standard walkers, while four-wheel walking frame enable high-functioning person to ambulate with appropriate amount of support and to become more independent. The purpose of walking frame are to enable maintenance of balance and mobility, to relieve weight bearing either fully or partially on a lower extremity, to support the body weight while walking or standing, and to minimize the fall risk. Procedure of using walking frame are include with walking frame measurement, method for use, and safety precaution. This is the walking frame measurement, which is to measure the suitable height of the walking frame with the client. Now, let's take a look with the video demonstration on how to measure the walking frame.
Walker adjustment. Stand up straight with your arms resting at your side. The walker height should be level with the bend in your wrist. There should be a slight bend in your elbows, about 30 degrees, when holding on to the walker.
Now, let's move on to method for use, which is getting up from chair using walking frame. This is the step of getting up from chair using walking frame. Now, let's move on to the video demonstration on getting up from chair using walking frame.
To get up from the chair, what the patient's going to do is, of course, make sure the walker is out in front of them. They're going to lean forward out of the chair, make sure their hands are on the handrest, and slightly extend that weak leg out. Then they are going to put weight on their hands by pushing up on the armrest of the chair and with their strong leg and putting their hands on the hand grip of the walker. Then they are ready to ambulate.
Now, let's move to the next method for use, which is walking. This is the step for walking by using walking frame. Next, let's move on to video demonstration on how to walking by using walking frame.
To ambulate with the walker, first the patient's going to get in position and hold on to the hand grips of the walker. First, they will lift and move the walker forward and then make sure all 4 points of the walker are touching the ground. Then they will move the weak side, put weight on the hands via the hand grips, and then move the strong side. Again, they will lift the walker, move it forward, make sure all 4 points are on the ground. Then they will move the weak side, put weight on the hand grips, and then move the strong side.
Next, we move to the last method for use in walking frame, which is sitting down on chair. This is the step for the client to sit down on chair using walking frame. Now, let's take a look at a video demonstration on how to sit down on chair using walking frame.
Sit down in a chair, a patient is going to take their walker, hold onto the hand grips, and slowly back up to the chair until they fill the chair with the back of their legs. Then they're going to slightly extend that weak leg out and take their hands and position them behind them and bend their strong leg and feel for the chair's armrest and then set down.
Next, we move to the safety precautions in using walking frame. First, we must ensure that the patient have adequate turning space in areas like bathroom or kitchen. The second one is, when getting up from a chair, never use the walking frame for support. And the third one is, walking frame is not appropriate for use on stairs or rough terrain. The last but not least is, we must regularly check rubber tips and wheels and replace it if worn or torn. For evidence-based in walking frame, according to Sadowski and Jones in 2014, walkers are suggested for conditions such as poor balance, generalized weakness, restricted lower limb weight bearing, and debilitating conditions. Other than that, according to Faruko and Jablon in 2010, walkers are improve a patient balance in 3 ways, which are increasing the base of support, supporting the patient's weight, and increasing the lateral stability of the client. For the conclusion, walking frames are mainly used to stabilize patients with poor balance and mobility. Different types of walking frame provide different levels of support and mobility to people who have varying needs. Other than that, walking frame users must measure the height of walking frames properly before using. That's all from me. Thank you.